Okay, so we're back with another topic of pediatrics, and this time it is the late onset neonatal sepsis. So, what is late onset neonatal sepsis, and what are the important points that you need to know about this disease? Number one, the onset, if the onset is after 1 week after birth, then it will be regarded as late onset neonatal sepsis, and the child will present with an ill look, hypothermia or hyperthermia or fever, abdominal distension, feeding intolerance, features of localization, for example meningitis, pneumonia, shock, poor perfusion, bleeding, petechiae, purpura, hepatomegaly, jaundice. So we know the symptoms of sepsis. The child presents with a toxic look, he has high grade fever, and he can have any localized symptoms or focal symptoms like meningitis, pneumonia, and it will be called as late onset if the symptoms occur after 1 week of birth, and it is called early onset if the symptoms appear within 1 week after birth. And the normal baby suddenly develops a refusal to feed. It is a classic picture, and he will be having a ill look, he will be having hypothermia or hyperthermia, abdominal distension, feeding intolerance, features of localization, bleeding, diathesis, hepatomegaly, and jaundice. So what are the types of neonatal sepsis? Number one, early onset if it occurs less than 1 week after birth, and the most important cause is vertical transmission from mother. And late onset occurs 1 week after 1 week of birth, and it is mostly as a result of hospital or community acquired infection. And the most common cause of neonatal sepsis, the organism responsible for it, is that overall it is a group B streptococci, and for early onset it is group B strep again, but for late onset neonatal sepsis the most likely cause is E. coli. So overall it is group B strep. Even for early onset, because of vertical transmission, it is group B strep, but late onset as a result of community acquired or hospital acquired infection, it is E. coli. So these are the important features that you need to keep in mind while reading late onset neonatal sepsis. Now, how will you investigate a child having sepsis? Number one, you will order a sepsis screen. And in sepsis screen, what you're going to be seeing is that if any two out of these 5 features are present, then the screen will be called as positive. Okay, and these 5 features include a TLC count or total leukocyte count of less than 4,000 or more than 30,000 per cubic millimeter, a neutropenia, that is neutrophil count of less than 2000 per cubic millimeter, a band cell to neutrophil ratio of more than 0.2, an ESR that is raised, and a CRP that is raised. So these are the features that you will be seeing in the sepsis screen. And this is if any two of the following 5 features are positive, then the sepsis screen will be called as positive for neonatal sepsis. Okay, so and these 5 features are TLC count, neutropenia, band cell to neutrophil ratio, ESR, and CRP. Now this was one investigation that you're going to be ordering, and these are the blood exams. You will take a blood sample and you will order a sepsis screen. Other investigations include blood culture, and blood culture is the gold standard while investigating neonatal sepsis. In addition to that, you can also see urea and electrolytes, which can be deranged, LFTs, which again can be deranged, and RFTs, which can also be deranged. And for localizing the source of sepsis, you can order a chest x-ray, a lumbar puncture, and CSF analysis, and urine analysis. So these are the important investigations while investigating neonatal sepsis: sepsis screen, and blood culture, urea electrolytes, LFTs, RFTs, and for localization purposes, chest x-ray, LP and CSF analysis, and urine analysis. Now, how will you treat a case of early onset or late onset neonatal sepsis? Number one, you will have to keep the infant in or the neonate in a thermoneutral environment, and parenteral nutrition should be started to maintain adequate nutrition. So a thermoneutral environment and parenteral nutrition. Secondly, maintain blood glucose and calcium. Oxygen saturation must be maintained. Mechanical ventilation might be required, and volume expansion might be required with crystalloids or colloids, and inotropic support if required, because in sepsis shock can occur, which can result in you can say hypotension. So these are the supportive measures which can be taken in a child with neonatal sepsis: thermoneutral environment, adequate blood glucose and calcium, oxygen saturation maintenance, mechanical ventilation if required, and volume expansion if there is hypotension. So these are the supportive measures. What are the specific measures which will carry out in a child with sepsis? Number one, there will be empirical antibiotic treatment till the positive blood culture. Till the culture keeps on coming positive, you will have to keep giving the antibiotics empirically. And the empirical antibiotics include 2 antibiotics, that is vancomycin plus amikacin, depending on the NICU flora and the department protocol. So every department has its own protocols for giving empirical antibiotics. Empirical antibiotic treatment means that that you are giving antibiotics before the culture results. So normally we give vancomycin plus amikacin, these two antibiotics, and they can vary depending on the which flora are more, you can say, prevalent in the NICU environment. Secondly, you have to change the antibiotics depending on the culture and localization. Then what is the duration of antibiotic treatment? It will depend on clinical sepsis screen. Or for example, if the culture is negative, but the sepsis screen is also negative. For example, there are less than 2 out of 5 features that are positive in sepsis screen, and the culture is also negative, then you have to stop the antibiotics within 3 days, because there's no point of giving antibiotics if the child is having a negative culture screen or negative sepsis screen. So in that case, the antibiotics will be stopped within 3 days. Now, what are the other scenarios? For example, if the screen is positive, like there are more than 2 out of 5 features which are present, but the culture is negative, then you have to keep giving antibiotics for 7 to 10 days. But if the culture is positive and sepsis screen may be positive or negative, but the culture is positive, but that there are organisms in the blood, for example microbes in the blood, then you have to keep giving the antibiotics for at least 14 days. So this was the algorithm for stopping the antibiotics. Now, but if the child is having a localization such that he's having meningitis, then you will have to keep giving specific antibiotics for at least 21 days. So this is an exception. Usually it was for 14 days for blood culture positive, but 21 days if the LP analysis come out to be positive, or if there is meningitis. What are the newer therapies for treating a case of late onset neonatal sepsis? These include IVIGs or intravenous immunoglobulins, exchange transfusion, granulocyte colony stimulating factor, and granulocyte monocyte colony stimulating factor. So these are the newer therapies which you can use in a child with neonatal sepsis. So these were some of the important points. I tried to explain or cover all the important points regarding this if it comes as a SCQ or an MCQ. So I hope it was helpful for you guys. Do watch my other videos and also subscribe the channel.